Okay, let's unpack this. We have a stack of source material today that is truly ambitious, even for us.
It's a lot.
It really is. I mean, this isn't just a simple critique of hospital efficiency or, a pitch for some new software.
Not at all. This is a foundational challenge. It's aimed at the very core of modern medicine.
And it's calling for a systemic, spiritual, and even a microbial reset.
That's right. Our mission here is to really get inside the vision of one particular physician, Dr. Katyali Srivatsa.
Who's referred to in the text as Dr. Shri?
It's exactly the self-proclaimed superbug maverick. And he looks at the entire healthcare establishment and, well, he sees failure.
And not just at the clinical level, right? It goes deeper.
Much deeper. He's looking at the ethical foundation and arguing that the entire system is fatally flawed.
Because it prioritizes two things above everything else.
Profit and dependency. And our challenge is to connect the dots, right? To go from his critique of, say, drug expenses and superbugs all the way to his proposed solutions.
Which involve ancient Hindu spiritual laws and, on the other hand, cutting-edge AI. It's quite a leap.
It is, but it's a necessary journey, according to the sources, because the crisis itself is so multifaceted.
So we're starting with let's be honest, the pretty cynical economics of modern healthcare. Then we're pivoting through the metaphysics of the soul, the principle of non-harm.
And then we land on something functional, something scalable, an AI triage system.
Designed to empower the patient. It's a huge scope, but I think the central idea is clear.
The current model is broken.
And real healing means shifting power back to the individual by conquering fear and understanding your own biology.
Precisely. If we don't grasp the depth of that systemic failure, how the profit motive actually created this culture of dependency, then we'll never understand why he had to look so far outside of conventional medicine.
To ancient philosophy of all places, for a blueprint.
For a blueprint for renewal.
All right, let's start with the money. The sources paint a really stark picture. They focus on that period between 2011 and 2019.
Right. And they argue that this is when profit margins became the explicit priority. It wasn't even hidden anymore. It was just the goal.
Overtaking actual healing outcomes and the scale of it. The sheer financial scale in the U.S. alone is just staggering.
It's hard to even comprehend.
Drug-related expenses exceeding $11 billion.
Daily.
Daily. That's not just a cost. That's a massive economic engine that is built entirely around the concept of illness.
And this is where you see the system's priorities laid bare. I mean, when you have a machine that huge, that processes $11 billion in pharma costs every single 24 hours.
The incentives are just permanently warped.
Completely. The sources highlight this paradox where preventive interventions, things we know are effective, like diet changes, lifestyle modifications.
The simple stuff.
The simple, cost-effective stuff. It's held to this impossibly high standard. It has to prove immediately that it saves more money than it costs.
But the expensive, complex treatments, the pharmaceuticals.
They're just approved.
Yeah.
Because they sustain the engine, even if all they do is manage symptoms without ever offering a cure.
So the system is actively rewarding the long-term, high-cost management of symptoms over the short-term, low-cost resolution of the actual root cause.
That's the dependency creation model in a nutshell.
It's a feedback loop.
It is. It's a feedback loop that's specifically designed to condition patients into reliance. The whole framework of doctor-centered care, which can be very paternalistic, right?
The doctor knows best.
Exactly. It conditions you to believe that health is this commodity you can only get through a consultation, through extensive repeated testing, and, of course, through strict pharmaceutical adherence.
The patient becomes a passive consumer, not an active participant.
Just a line item in a budget.
And what about the physical costs of this? I mean, beyond the financial toll, what does this reliance on pharmaceuticals do to us, according to the source material?
Well, the biological cost is significant. This model, this long-term reliance on drugs, it's shown to cause significant and lasting changes in brain chemistry and function.
So it's not just a psychological dependency, like I need my pill,
It's chemical entrapment. That's the term they use. Your brain is literally being rewired.
Wow.
And so patients get locked into these cycles of symptom management. The drugs treat the symptoms, but then they often create secondary problems, side effects.
Which require more drugs.
Which require more medical intervention. And you're never, ever able to address the underlying problem. You're just chasing symptoms.
And this inherent conflict, the goal of making money versus the goal of actually making people well, that leads right into the ethical crisis the sources talk about.
It has to. I mean, the medical profession is held up as this noble calling, but the system's structure forces a kind of moral compromise.
You start to see critiques of, well, palace attitudes, unethical practices.
Systemic abuse of power,
Mm-hmm.
and a lot of it is fueled by this passive income motive. If your financial security depends on that patient coming back again and again for repeat consultations, for ongoing prescriptions,
Then your motivation to find a radical, permanent cure is, well, it's diminished, isn't it?
the focus shifts. It's no longer about patient wellness, it becomes about patient retention. And that's a distinction that Dr. Srivatsa seems to find morally reprehensible.
Okay, let's pivot from the financial crisis to the second major one, the existential threat of antimicrobial resistance, AMR.
Right.
And Dr. Srivatsa was clearly way ahead of the curve on this. He was sounding the alarm way back in the 1980s.
Decades ago, he made this dramatic proclamation that the era of kill, conquer, and rule has abruptly ended.
What did he mean by that? The era of antibiotics conquering bacteria.
Exactly. He realized that humanity's hubris, our belief that we could just dominate nature with these miracle drugs, was completely unsustainable.
We're facing the revenge of the microbes.
That's a good way to put it. And while an organization like the WHO, the World Health Organization, currently estimates AHR could lead to 10 million deaths a year by 2050.
Which is already a horrifying number.
It is. But Dr. Srivatsa's own analysis, the one mentioned in the texts, is far more terrifying.
What was his prediction?
His predictions suggested that AMR could wipe out a generation,
Wipe out a generation.
potentially killing more than 1 in 3 healthy adults and children by the year 2060.
1 in 3. That's not a health crisis. That's a societal collapse. What's the specific mechanism that makes this threat so powerful, according to his work?
It goes back to historical precedent. If you look at major disease outbreaks, most people who die, whether it's a viral pandemic or even chronic conditions, they don't actually die from the initial thing.
They die from something else that takes advantage.
They die from a secondary bacterial or fungal infection that their weakened body can no longer fight off.
The source gives the example of the Spanish flu, right?
A chilling example. What was truly lethal back then were the Staphylococcus secondary infections. They were devastating because, of course, antibiotics didn't exist yet.
And the terrifying irony now is that we have the miracle drugs, but we've squandered their power through misuse.
We've completely squandered them. We're now facing a situation where the bacteria have evolved, they're resistant, and the data from the COVID-19 pandemic is used to illustrate this perfectly.
How so?
Well, the sources report that over 90% of COVID patients who were admitted to hospitals were prescribed antibiotics
For a virus.
for a virus, often indiscriminately. This colossal overuse, just during that one global event, it massively accelerated the evolutionary pressure on bacteria. It pushed resistance to critical levels.
And this systemic failure, this inability to control our own tools, leads directly to Dr. Sri's really sharp critique of the big institutions, the WHO, the CDC.
Oh, he doesn't pull any punches.
No, he doesn't just disagree with them. The text says he accused them of living under an illusion based on theoretical idealism without understanding the practical realities of managing infections in the 21st century.
That's a strong accusation. But you have to remember, it's rooted in his experience.
Yeah.
He's a clinician who is dealing with resistant microbes day in and day out.
He's on the front lines.
He's on the front lines, and he saw these institutions operating in a kind of theoretical bubble, totally detached from the messy reality on the ground.
So when they implemented these huge centralized protocols like broad quarantines, lockdowns,
He argues they caused immense collateral damage. Necessary in some cases, maybe, but often too generalized. Tearing families apart, bankrupting nations, creating huge social upheaval.
all based on models that couldn't account for the practical reality of how infections actually spread in a community.
Precisely. His critique isn't necessarily about the intent. It's about the centralized, inflexible methodology. He's basically saying their idealism led to these impractical, damaging solutions.
And the proof is their failure to curb the irrational use of antibiotics, even though they knew we were approaching the AMR cliff.
Exactly. That failure to manage antibiotic distribution, which is a practical supply chain and public health issue, that's the evidence, in his view. It shows that centralization leads to this bureaucratic inertia, an inability to adapt to microbial reality.
And this is the key transition point in the material, isn't it? If the established scientific and financial systems are failing us, both ethically and practically.
Where do you look for a stable foundation?
And for him, the answer was ancient spiritual philosophy.
It's a huge pivot, but it's where the whole argument goes.
Here's where it gets really interesting. We take all this disillusionment with modern medicine and we pivot entirely into the realm of ancient concepts.
Because for Dr. Srivansa, true healing, and therefore the reform of the entire system, has to align with universal spiritual law.
It's a foundational shift.
It is.
Yeah.
He sees the failure of modern doctor-centered care as fundamentally a moral failure. Because what does it rely on?
Fear.
It relies on inflicting fear.
Yeah.
Fear of complication, fear of death, fear of the unknown diagnosis. And this practice is deemed unethical because it disrespects the body's own wisdom, its own power to self-heal.
It violates that core principle of non-harm. And that idea, conquering fear, that's the centerpiece. The ancient Hindu scholars, the Rishis, they emphasize that the one and only emotion you absolutely must conquer is fear.
Mm-hmm.
Why is that single emotional victory so critical to our physical health? How do the sources connect a spiritual discipline like that to, hard biology?
Well, physiologically, it's pretty direct.
Yeah.
Unconquered fear means you are perpetually activating your sympathetic nervous system.
The classic fight or flight response.
Right. And that state of chronic high alert floods your body with stress hormones, cortisol, adrenaline. Your body thinks it's constantly being chased by a tiger.
And the source argues this chronic activation is the root cause of chronic illness.
Yes. It leads to persistent fatigue, reduced concentration, a weakened immune system, systemic distress. If you live in a constant state of fear, your body is always running a marathon it simply cannot afford. It breaks down.
So conquering fear isn't just about mental peace. It's a vital anti-inflammatory strategy. It's a longevity strategy.
That's a great way to put it.
And this connects directly to ahimsa, the principle of non-harm. How does a universal moral duty like that translate into design specifications for a new health system?
Well, ahimsa, which is defined as the universal law of do no physical or mental harm to another soul, that has to be the blueprint. The system cannot be fear-driven. It has to be empowerment-driven.
The sources get really specific about this.
They do. They talk about unethical practices that violate ahimsa, even if it's unintentional. For example, a doctor discouraging a patient with a minor disease from getting a consultation because they think the symptoms are trivial.
Right.
That act inflicts mental pain and suffering. That trivialized pain, if it's left untreated or just unrecognized, it often leads to real complications down the line. It increases future healthcare costs.
So the primary duty is to uphold ahimsa, to protect humanity.
By designing a system that respects non-duality, interconnectedness, and radical self-empowerment from the very, very start.
Okay, let's dive into the deep metaphysics now, because this is a big one. The radical idea that the essence of the soul, the Atma, is connected to the concept of the God particle.
It's a fascinating synthesis, but we have to be really clear about the concepts here.
Okay.
The source isn't literally claiming that the Atma is the Higgs boson, the particle that gives mass to other particles. That's not it.
That's more of an analogy.
It's an analogy for an unseen unifying force. The Atma is described as the metaphysical essence of the soul, the battery that runs the body, which resides in the heart until the moment of death.
So the Atma isn't mass-giving, it's life-giving.
Exactly. It's the ultimate attractor. The source uses this incredible analogy that the Atma acts like Michael Jackson stepping into a town center.
Ah, okay.
Its presence is such a powerful force that it just attracts and connects all these unknown atoms and particles, unifying them to create mass, to create structure, to create life itself.
It's the unifier, the source of consciousness, the battery pack.
The essential battery pack, yes.
And this holistic view is a fundamental challenge to the Western reductionist medical perspective, which brings us to the concept of Maya, the great illusion.
Mm-hmm.
How does modern neuroscience actually support this ancient idea that our sense of self isn't fixed?
Well, the sources point to neuroscientific findings related to the temporoparietal junction.
The TPJ.
The TPJ.
Mm.
This is the area of the brain that's responsible for integrating all of our sensory information and creating that unified sense of self, that feeling that you are located right behind your eyes looking out at the world.
That's the illusion. That's Maya.
That's the illusion created by the brain's internal operating system. And when that integration process gets disrupted through, say, electrical stimulation in a lab or trauma or a near-death experience,
Consciousness can fracture.
it can fracture, and you can get openings to what the texts call hidden streams of reality.
That is a powerful analogy. It's like our everyday reality is just the desktop view, but there's this vast, complex code running underneath.
A perfect analogy.
But here's the major leap. Connecting this expansive spiritual reality, Atma and Maya, to the tangible mechanism of karma and microbial exchange.
It is a radical leap, but this is what Dr. Srivatsa sees as the ultimate mind-body connection.
So explain this. How does it work?
The Hindu concepts of samsara, the cycle of rebirth, and karma, the duty to complete one's task or destiny, are explicitly linked to our biology.
Okay.
The source identifies 7 critical individuals: the mother, teacher, father, doctor, friend, employer, and spiritual leader, who shape a child's ability to fulfill their karma.
And normally we'd assume the shaping is, purely behavioral, lessons, advice, role modeling, but you're saying the source suggests the exchange is physical.
Precisely. The critical mechanism is not just behavioral influence, it's the physical reality of microbial exchange. The longer a child interacts with these 7 key individuals,
The more microbes are exchanged.
the more microbes are exchanged.
Yeah.
And the child's behavior, their mood, their way of thinking, their actions, all of it is argued to depend on these specific microbial influences.
Wait, hold on a second. This is a massive leap. How does the source empirically support the claim that karma, one's life task, is biologically mediated by bacteria? That sounds like spiritual determinism based on your gut flora.
And that's the essential question the source forces you to confront. The spiritual aspect, the karma, is philosophical. But the mechanism relies on accepted biology.
The microbiome shapes our neurochemistry.
Right. It shapes mood, motivation, behavior. Therefore, if your duty, your karma, requires certain behaviors like discipline or compassion, and those behaviors are modulated by the microbes you exchange with your primary shapers.
Then spiritual duty becomes biologically mediated.
It does, which means a doctor has an extraordinary microbial duty of care. They're not just treating an illness. They are potentially altering the patient's capacity to complete their life's task by influencing their internal ecosystem.
The profound insight here is that spiritual interconnectedness is physically, biologically real. Every interaction is an exchange, and that exchange dictates your capacity. That's a staggering concept.
It gives immediate physical weight to all of our social responsibilities.
And this realization that the microbiome is the physical manifestation of interconnectedness, that's why we have to dive into the specific biology of the gut-brain axis next.
Yes, let's get into the nuts and bolts.
Having established this philosophical mandate that healing requires self-empowerment and conquering fear, and that our behavior is mediated by this microscopic universe, let's move to the hard science, the gut-brain axis.
The two-way communication highway.
Between the gut and the central nervous system.
And this highway is absolutely essential because the gut microbiome functions as a highly specialized chemical factory.
A pharmaceutical plant designed by nature.
A perfect description. Your gut bacteria are synthesizing the very neurotransmitters that dictate your mood, your stress reactions, your entire mental landscape. We're talking serotonin, dopamine, and GABA.
Now, we often think of serotonin as being all about mood, but most of it is actually produced in the gut, isn't it?
That's right. The vast majority of your serotonin is synthesized and stored in what's called the enteric nervous system in your gut. And it regulates not just mood, but also digestive motility and satiety. It suppresses hunger signals.
And dopamine, the motivation molecule.
Also modulated by your gut flora. That feeling of accomplishment, of pleasure, of motivation to get things done. And then there's GABA, the primary inhibitory neurotransmitter.
It's a calming one.
It's the brakes on your nervous system. It helps calm you down, manage stress reactions.
So our microbes are literal microscopic chemical messengers. They're influencing neuroinflammation, synaptic plasticity, even the integrity of the blood-brain barrier. How do they actually communicate these complex signals?
There are 3 main routes. The first is the vagus nerve, which is the fast physical link. Then you have neuroendocrine signals. And critically, they communicate through microbial metabolites.
The byproducts of their metabolism.
Exactly. And chief among these are the short-chain fatty acids, or SCFAs.
Okay, let's get specific about those SCFAs because they seem crucial. What are the most important ones and what do they do?
The 3 big ones are butyrate, propionate, and acetate. Butyrate is maybe the most critical for our health. It's the main fuel source for the cells lining your gut, the clonocytes.
So it keeps the gut wall strong.
It maintains the integrity of the gut lining, which in turn protects the blood-brain barrier. If that barrier is compromised, if you have leaky gut, inflammatory molecules can cross into the central nervous system.
Which is obviously not good.
Very bad. Then you have propionate and acetate, which are more involved in glucose metabolism, appetite regulation, and energy balance. A deficiency in any of these SCFAs is linked to systemic inflammation and poor brain function.
So when this intricate symphony goes wrong, when we have dysbiosis, What's the consequence for our behavior and mental health, according to the sources?
Dysbiosis, an imbalance in your gut flora, is strongly linked to a whole spectrum of mental illnesses, major depression, chronic anxiety, even conditions like autism spectrum disorders.
It's that constant state of low-grade inflammation.
That's a huge part of it. It's viewed as a major contributor to poor mental health, lack of concentration, cognitive decline. Your microbiome is the constant mediator between your body's internal state and your emotional and behavioral output.
And to bring this idea of microbial control to life, the sources have some fantastic anecdotal evidence. The idea that bacteria might be the puppeteers of our emotions.
Yes, the observations about different types of alcohol are particularly insightful.
Tell us about that.
The texts note that drinking whiskey on an empty stomach often brings on feelings of sadness or regret. It can bring up old memories, unresolved emotional stuff.
Whereas champagne.
Champagne often transforms a reserved person into an uninhibited, almost manic social butterfly, only to leave them feeling empty afterwards, like a blank slate.
Why the difference? What's the theory?
The deduction is that the different microbial or fungal colonies in those drinks react differently with your existing gut flora. They produce distinct neurochemical cocktails that temporarily hijack your emotional state.
So the bacteria are the real emotional conductor.
The puppeteers, yes.
And this extends even to attraction and relationships. The sources suggest attraction is less about perfume and more about the invisible microbial clouds surrounding you.
It's a microbial compatibility test. The source explicitly says that if you meet someone and your microbial colony is similar or complementary to theirs, the relationship might just bloom.
Because your internal chemistries are literally in harmony.
Exactly.
Yeah.
And this leads to some very specific and kind of funny dating advice.
Which is?
Avoid fermented drinks like wine on a first date. The fungi, or bacteria in the yam, could produce disruptive chemicals that get in the way of a real emotional connection.
So what should you do instead?
They recommend sharing an ice cream or a milkshake. And to choose the fruit wisely, noting that couples who share that particular experience tend to have long-term success.
You're optimizing the microbial exchange for a positive emotional outcome.
You're viewing the date as a planned microbial exchange. You're trying to foster a compatible neurochemical reaction. And this moves us perfectly into the practical implications.
Right. If microbes dictate so much, what can we actually do to ensure microbial harmony?
Diet is absolutely paramount. The emphasis is on a varied, plant-based diet rich in fiber and specific prebiotics.
What are prebiotics again?
They're non-digestible compounds that feed your good bacteria. Things like inulin, which you find in onions, garlic, chicory root, and FOS, fructooligosaccharides.
They're food for the good guys.
Exactly. They allow them to produce those crucial SCFAs. And then you have fermented foods like yogurt, kefir, kimchi, which directly introduce new, diverse strains of beneficial bacteria.
And beyond the general diet, what about specific neuroboosting nutrients to support brain function?
For optimal neurochemistry, you need specific building blocks.
Yeah.
Foods rich in tyrosine like eggs, bananas, poultry are recommended because tyrosine is the precursor molecule your body needs to make dopamine.
Then what about protection?
For that, you need lots of polyphenols and omega-3 fatty acids. You find those in fatty fish, flax seeds, olive oil. They have powerful neuroprotective effects, reducing neuroinflammation and supporting synaptic plasticity.
And finally, the mental health components, stress management and exercise.
This closes the loop. It brings us right back to conquering fear. Stress management techniques like yoga and meditation are essential for lowering cortisol levels.
High cortisol is bad for your microbiome.
It's devastating to microbial diversity. And at the same time, 30 minutes of daily exercise is critical, not just for fitness, but because it boosts the release of endorphins and dopamine. It directly counteracts the biological damage caused by chronic fear.
You know, this whole philosophy of self-care and microbial balance, it's not entirely new. It takes us back to some ancient concepts of infection management in India.
Indeed. The sources analyze these historical practices through a modern public health lens. They discuss how Hindu Brahmins, recognizing that disease spread through bodily waste, created the very criticized untouchable system.
Which is obviously profoundly complex and historically sensitive.
Absolutely.
Yeah.
But the source views it from a purely public health perspective as a sort of primitive form of hygiene and mandated isolation, a way to protect the community from people handling night soil and sewage, which carried known infectious agents.
And then there's that fascinating, if controversial, practice related to early inoculation against smallpox.
Right. The texts describe a kind of precursor to vaccination. The practice of priests in Kali temples who would perform ritual sacrifices and, during smallpox outbreaks, smear the blood onto disciples through small cuts,
And the blood contained the virus antigen.
prompting a localized immune response and, hopefully, protection. Now, the source is careful to acknowledge that formal smallpox inoculation was documented in China and spread later,
But it highlights that this traditional Indian wisdom had these sophisticated, if ritualized, methods of infection control based on practical observation.
which underlines the core argument. The solutions for our future have to respect the ancient wisdom of interconnectedness and prevention.
So we have the diagnosis of a broken, profit-driven system. We have the philosophical mandate of ahimsa, and we have the biological understanding of the microbiome.
Right.
Now we get to Dr. Srivatsa's operational solution, Dr. Maya AI, the system he designed to unify all three of these pillars.
And the design of Dr. Maya GPT was, according to the text, born from trauma.
His own trauma.
His own. The sources say he faced punitive sanctions from major institutions like the NHS and the GMC because he was so aggressively defending humanity and challenging their established protocols, which he saw as harmful.
And that experience solidified his mission.
To create a system that was impervious to institutional fear and financial corruption. Its core mission is profoundly humanitarian, to bring tears of happiness.
By fighting infections, saving lives, and drastically reducing social inequalities in health.
Exactly.
And the initial insight that led to its development was actually incredibly straightforward, wasn't it? It's based on Pareto's principle.
Absolutely. He realized that a huge majority of patient consultations, the heavy workload that strains the whole system, could be traced back to just 12 common symptoms.
Just 12.
Just 12. So by creating robust, rule-based algorithms to accurately assess those 12 symptoms, he can empower junior doctors and eventually patients themselves to quickly distinguish between a benign, self-manageable illness and a severe condition that needed immediate attention.
And that would drastically reduce unnecessary hospitalizations and clinical dependency.
That's the goal.
Now, Dr. Maya is described as moving beyond these opaque black box systems toward a transparent, patient-centered, color-coded triage. Why is that transparency so crucial here?
Transparency is the technological expression of empowerment. It's the exact opposite of the dependency model.
A black box algorithm where you don't know the reasoning just reinforces the doctor knows best idea.
It perpetuates dependency and distrust. But Dr. Maya uses a transparent, color-coded system designed to transcend cultural and educational barriers. So you don't just get a diagnosis, you understand the reasoning behind it, and that builds your health literacy.
Let's walk through this color-coded system, which is described as being fundamentally an ahimsa-based directive system.
Okay, so the system gives very clear directives. First, you have red symptoms.
Red means urgent.
Urgent, yes. It requires immediate attention from a doctor, though not necessarily an emergency room visit. It just signals a high-risk situation that needs professional input. But you yourself are generally not an immediate threat to others.
Then you have green and yellow.
Right. These are conditions that can be managed locally. Green suggests you consult a service like NHS 111 or a nurse triage line. Yellow points you towards self-treatment or talking to a pharmacist.
So that offloads the non-critical burden from the hospitals.
And puts power back into the patient's hands. But then you have the most important one.
BLUE symptoms, the infection control override.
This is the critical ahimsa-based rule. The presence of any blue symptom, which denotes a highly infectious condition, immediately overrides everything else.
So what does it tell you to do?
It tells you that you must seek immediate help and you must isolate yourself. And crucially, it explicitly tells you not to visit hospitals or doctor's offices in person.
Wow. That BLALE code is the technological implementation of the moral duty to do no harm through infection.
It makes your personal health behavior a global public responsibility instantly.
It shifts the accountability. So instead of waiting for a centralized body, like the government, to mandate a quarantine,
The empowered individual, guided by transparent AI, performs their duty of ahimsa by proactively isolating themselves.
which prevents spread and mitigates the risk of fueling AMR by reducing cross-contamination in waiting rooms. Dr. Maya becomes a kind of digital gatekeeper.
Protecting both the individual and the community.
And the practical implementation, especially in underserved markets, is tied to a pretty ambitious financial model.
It is. In a region like Karnataka, India, for instance, where significant logistical hurdles prevent over half of all women from accessing timely health care, Dr. Maya provides a vital, immediate digital access point.
And the model projects aggressive financial growth.
It does, from 19 crores to 328.2 crores in 5 years, which sounds very high. But the key is that the profits are earmarked for social impact
To fund free healthcare for the disadvantaged.
and provide support for harassed healthcare professionals and facilitate essential rural healthcare expansion.
So this is designed to be a financially sustainable engine, but its profits are ethically reinvested to solve the very social inequalities that the centralized profit-driven model made worse.
It's a complete inversion of the current system.
The goal is a replicable model for the global south and eventually for developed markets that are looking for prevention-focused cost reduction.
Exactly. Instead of profit-creating dependency, here, financial success is engineered to create social good and empowerment. It ensures that the technology serves humanity, not the other way around.
Okay. This deep dive has traveled through economics, existential threats, ancient spiritual principles, microbial puppetry. Let's try to synthesize all the elements of Dr. Srivatsa's vision into one cohesive framework.
All right. We began with the diagnosis, right? The centralized, profit-driven healthcare system is built on a foundation of theoretical idealism.
Prioritizing financial metrics and dependency over practical healing, which leads directly to the AMR crisis and ethical compromise.
Exactly. Then we have the guiding principle for reformation, drawn from Hindu wisdom, the principle of ahimsa, non-harm, and the psychological necessity of conquering fear.
This foundation demands a system that respects the body's self-healing power and sees consciousness, the Atma, as the unifying life force, not just some chemical byproduct of the brain.
And the operational foundation is the realization that the body is biologically interconnected. The microbiome mediates our health, our emotions, our behavior, even our spiritual duties, our karma.
Which means we have to promote self-reliance, rigorous prevention, and avoid pharmaceutical dependency by actually addressing the root cause. And Dr. Maya AI, then, is the practical tool. It's what translates this philosophical and biological mandate into actionable steps for everyone.
It is. It steps away from that slow, centralized bureaucracy that Dr. Sri criticized so heavily, and it creates a structured, individualized coordination model instead.
The AI is the blueprint for a new kind of global coordination.
Yes, it's transparent, color-coded directives, especially that BLUE code mandate for immediate isolation. It puts the practice of ahimsa directly into the hands of the individual.
So every person becomes a knowledgeable, accountable participant in global health security.
Instead of a passive dependent consumer, the core message is empowerment. It's about providing equal access to the best healthcare information so people can overcome that fear of death or complication if they delay contacting a doctor.
So they can make intelligent triage decisions for themselves.
Right.
You know, when we look at the system as a whole, it really mandates a fundamental shift in how we define public health responsibility. When we manage our symptoms responsibly, when you use the BLUE code to isolate immediately based on a transparent AI assessment, you're practicing ahimsa on a global scale.
You're exercising your microbial duty to the community.
And that really is the provocative thought we want to leave you with today.
It is. If the sense of self, Maya, is truly just a story that the brain tells itself, and if our deepest emotions, our behavior, our social responsibilities, our karma, are fundamentally guided by this vast, intricate, microscopic universe within us,
then the concept of well-being expands far beyond just blood pressure and cholesterol, doesn't it?
It has to. It requires aligning our internal microbial state with a moral imperative. So how does conquering your own individual fear, the one emotion the Russians insisted we must defeat, become the most powerful form of prevention, not just for your own chronic illness, but against the next global threat?
The profound interconnected reality of our consciousness and our microbes. It fundamentally shifts what it means to be responsible for our own survival and for the well-being of all of humanity.
And this whole framework, it really encourages you to explore the sources' rich literature on Ayurveda, on the microbiome, and on the philosophy of fear. Because the journey to true global health, it begins quite literally within you.